The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name is Mark Ryan, and it's a pleasure to be hosting this podcast, and thanks to everyone for listening. As I talked about the last 2 weeks, we have some exciting new things on the podcast. We have some music with an intro and music with an outro. And we also have ads that we're running now. So we take a few breaks during the podcast. The first ad usually is on the Healthcare Labyrinth website and all of the resources you can find there. And the second ad talks about my book, The Healthcare Labyrinth, and how to purchase it. It is a guide to navigating health plans and fixing American health insurance. So let's get to the topic of the day here. And the topic is the Change Healthcare cyber attack. We're going to spend, our time today talking about what is Change Healthcare, how large and impactful they are in the healthcare system, what happened with the cyber attack, what's the status today as far as we know it, as well as what are some of the implications for Change Healthcare, Optum and United, their owners, and also just general topics about what this major cyber attack may mean for the nation and our readiness and preparedness moving forward. So just a little bit about cyber attacks in general. We know that cyber attacks are on the rise really throughout the nation. This could be attacks on municipalities and state governments and even the federal government. And it is also attacks on companies. And these can occur really throughout all types of companies. We know we see a lot of it in the retail sector because information can effectively be stolen by cyber attackers by targeting retailers and things like that who have a lot of credit card and other personal information. But obviously in healthcare, the attacks are very prevalent as well. And this is largely because, again, there's a lot of information that a attacker can steal. An attacker can steal personally identifiable information as well as personal health information. And obviously, attacks can come with penalties from HHS and other enforcers at the state and federal level. So let's talk a little bit about the rising rates of cyber attacks in the healthcare industry. So one recent study indicated that from 2018 to 2022, large breaches were up by about 93%. So almost a doubling of large breaches in terms of cyber attacks in just a couple of years. The other interesting thing is that in that same time from 2018 to 2022, there was also a 278% increase in large breaches where ransomware is an issue. In the case of ransomware, as opposed to hackers getting into a system and potentially just stealing information, in the case of ransomware, hackers will penetrate systems and they will deposit viruses that will essentially stop the functioning of the system, as well as potentially steal information as well. And this has led companies to paying millions and millions of dollars in ransom along the way to essentially get their systems back online. Sometimes a paid ransom provides the ability to essentially get back up and running quickly. In other cases, attackers have not fulfilled their end of the bargain to free up the software again. So 278% increase from 2018 to 22 in large breaches related to ransomware, and then generally a doubling, about 93% increase in large breaches in that time overall. In 2023, HHS says that there were about 124 million records of Americans impacted by cyber attacks. So that's, roughly a little more than 1/3 of the nation. We have about 330 some million people in the nation. So that's about, about 38% of Americans potentially had impacts due to cyber attacks. We'd also note that when you think about breaches that were 500 plus records, the number of breaches also have gone up well over the last dozen or so years. So in 2010, the number of breaches recorded by HHS with 500 or more records was about just below 200, 199. By 2023, HHS had reported to it through the mandatory reporting 725 breaches that impacted 500 plus records. So again, more evidence that the number of breaches in healthcare and the impacts and cyber attacks are increasing a great deal. So let's talk a little bit and give a brief overview about what happened with Change Healthcare. While you could argue that there have been larger breaches out there, and again, we don't know the numbers yet for Change Healthcare. That won't come in time. Most of what's occurring right now with Change is to try and get things back online. But I think you're going to be able to argue that in terms of records impacted and released into the public and unprotected, you might actually have a larger breach that's been recorded over time is my bet. But I think the Change Healthcare cyber attack will go down as the most impactful cyber attack for a very, very long time. The scope of this cyber attack was incredible in terms of the number of systems and the number of providers and the number of patients that were impacted. So again, let's go through really quickly what happened, and then we'll dive a little deeper into all of this. So we are about a little over a month when we're recording this. We're recording this in the third week of March. The attack happened on February 21st, 2024, and Change Healthcare reported that it was a victim of a cyber attack. And again, it appears that that attack was a ransomware attack by what's known as the Black Hat organization and its affiliates. And we'll give you a little more information on that in a little bit later. Black Hat is known to target the healthcare industry, and we've seen Black Hat out there before. It's also rumored that Change Healthcare may have paid a ransom because of the ransomware attack by Black Hat on its system of as much as $22 million. But this has not been confirmed at all by Change Healthcare or Optum or United, its owners. The attackers claimed that about 6 terabytes of PHI and PII data were stolen, and that in and of itself could probably be tens of millions of Americans impacted potentially. Change as of yet is still recovering and has been doing so over the past month or even the month and a half by the time this airs. I would suspect that the recovery will take, honestly, several more months to really move forward in a fulsome way for Change Healthcare. It has not stood up alternative infrastructure for everything that was impacted. And again, the number of systems were profound, well over 100. So it is making progress, but a lot remains offline. And this has had huge implications for the healthcare system, and we'll talk a little more about that. Because of the major impact on the healthcare system as a whole and on providers, United Health Group, Change's parent, has made as many as $3 billion in assistance available to providers and others impacted as of this recording. And in addition, the Centers for Medicare and Medicaid Services and the Department of Health and Human Services is paving the way for advanced payments and other assistance via the Medicare fee-for-service system and state Medicaid programs. So the feds are trying to step up here as well. I will tell you there's been a great deal of criticism of Change and United's approach and disclosure in terms of giving information and trying to be helpful in terms of what's happened. Many people feel that Change and United were very slow on the uptake and far too secretive. And also lawmakers are criticizing the Department of Health and Human Services and CMS's response to this. It took somewhere about 2 weeks for CMS and HHS to actually make public statements on this, call meetings together, and actually create some assistance programs and urge everyone involved to help mostly providers who have been heavily impacted by the outages caused by the cyber attack. So what is Change itself? So Change Healthcare evolved over time and really was a number of different disparate technologies and companies actually put together as Change Healthcare. It was actually bought by Optum, which is the service subsidiary of United Health Group, in late 2022. It was announced sometime in 2021. It took some time to be approved by state and federal regulators. And it was bought by United Health Group and Optum, the service subsidiary, for about $13 billion. So it was a very, very large sale. And beginning in 23 is when Change started to be integrated into Optum in the United Health Group overall. Again, Change has numerous technology and other assets, which really touch almost every corner of the healthcare system. Without getting into specifics of the products themselves, I sort of put together a table that was in my March 21st, 2024 blog on this. You could certainly go to Healthcare Labyrinth website, to the blog tab, and look for the March 21 blog to see the table. But I'm going to sort of try and quickly walk through this now to show you really how far-reaching Change's tentacles are and how the cyber attack really impacted so many. So it impacted physicians' offices and other providers, probably about over 1 million physicians. Dentists rely on Change Healthcare a great deal. Tens of thousands of dentists impacted. Pharmacies, also tens of thousands of pharmacies impacted. Health plans and third-party administrators that help health plans together. Health plans and third-party administrators using Change was probably somewhere about 2,500. So let's talk about health plan impacts first. So Change really has a number of different systems that health plans rely on. Well, first, there are some impacts in the technology that was offline related to claims adjudication and encounter submissions. There is a prominent medical necessity tool that Change owns, which is called InterQual Connect and InterQual Criteria. And this is really used by health plans for prior authorizations and some care management transitions. Change has a big letter fulfillment shop, which is used for printing, especially some of these explanations of benefits that go out to members. So that was impacted on the health plan front. Electronic provider evidence of payment and claims submissions and status was impacted. A credentialing system was impacted for health plans. Change is also a certified HEDIS vendor, and we'll talk a little more about impacts there, but that's the quality measure submission system that needs to go to regulators and NCQA every year. And Change is one of those HEDIS vendors. Eligibility systems and software were impacted for health plans. Risk adjustment processes, including ACA Edge service were impacted. Financial services and technology was impacted for health plans, and cost transparency tools that are created and hosted by Change Healthcare was impacted as well. Let's move on to providers and hospitals and physicians. So in this world, quite a bit was impacted as well. And so, number one, eligibility services, which are facilitated by Change, created issues with having, hospitals and other providers either confirm eligibility within health plans and things like that. Then claims. So creating claims and submitting claims was impacted due to the Change outage. Billing of patients for any cost sharing or other costs related to their health care was also down. Encounter submission from a provider, for example, to a health plan was down. Cost estimator tools here were also down that providers rely on. And also that same interqual prior authorization and care management criteria that health plans use can also be used by providers and hospitals up front to assess medical necessity and things like that. So all that was down for providers and hospitals and physicians. Over on the pharmacy side, the pharmacy backbone for a lot of these pharmacies is the Change Healthcare system. And so again, eligibility was impacted, claims submittal was impacted, and billing was also impacted for pharmacies. And I would also note that there's a very large cloud service that is provided by Change Healthcare that is a key data depository, image depository, and lab depository for providers and health plans and others out there. So that was impacted as well. So how far-reaching was the impact? So as you can see from what I just described, obviously the cyber attack impacted pharmacies and providers in a great way, as well as even health plans. Essentially, as I said, pharmacies and providers under contract with Change were unable to bill health plans or patients as electronic and other options were unavailable. At health plans, inbound claims from providers dried up if they were fully reliant on Change. Even big plans, which generally have many different ways of bringing in eligibility and claim requests, saw a large percentage reduction of incoming traffic, somewhere around 20%. So that's significant. One study of hospitals and providers concluded that claims dropped by about a third nationwide initially. So that's major. The American Hospital Association reported that 94% of all hospitals were impacted. And Change handles, according to recent studies, about 15 billion transactions a year and 1.5 trillion claims annually. So if you look at even 1 month of those figures, it's an amazing impact. And an estimate suggests that Change touches about 1 in 3 patient records. So again, in round numbers, let's say about a third of all activity either came to a halt in some cases or was impacted out there because of this cyber attack. I note that while health plans had numerous impacts, clearly the financial impact was less for health plans given their size and generally their financial resources. Providers were the ones that were very much impacted. Providers, as a round figure, generally have cash on hand to function for really no more than 60 days. So a month downtime is really a major, major issue for them. And the requirements to catch up is going to be big as well. So the disruption for providers was very huge. There are some studies already coming out from ratings firms and things like that that suggest that smaller providers' liquidity and financial stability will be a big, big worry in 23. especially if the fallout continues. One key point, change is so far-reaching that the cyber attack and disruption is said to have cost providers between 500 million and 1 billion in payments a day. It's hard to really know exactly what those numbers are, so that therefore there's sort of a wide range that's out there from many different firms that have done analyses. At any rate, we do know it will take a long time to catch up, and that liquidity concern is going to be a major problem for the healthcare system in general. It will have far-reaching impacts really across the board. With that, we're going to take our first break, and then we'll come back and go a little deeper into what the cyber attack actually was and what the status is now.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we're going to start now to go a little deeper into what exactly was the cyber attack that Change suffered. Well, details, again, are sparse because Change has not really been very disclosive for a number of reasons, including the investigation and security. But most or all of Change's technology systems were brought down via what's known as a ransomware attack, as I pointed out earlier. I talked about Black Cat, and this is how Black Cat basically operates. It accesses and compromises user and admin accounts in the Active Directory or related authentication system, sort of a single sign-on mechanism. The approach allows the cyber attacker to take advantage of any vulnerability it can locate throughout an ecosystem. So if it's attacking the Active Directory, all they need to really find is a vulnerability throughout that ecosystem. It could target the organization hosting the software and the sign-on Active Directory. It could target associated vendors that may be integrated into that system. And it could even, attack or look for vulnerabilities for clients using the system. So there's many different ways that you could essentially attack a system that is, attack a system using this Black Hat ransomware, since it is attacking the Active Directory or related authentication system. If anyone has a vulnerability or fails to close a known vulnerability timely, the attacker gets in. They then deploy the ransomware to disable the systems. The entity impacted is asked to pay a ransom to have the systems re-enabled and to return any stolen information. That so many systems at Change actually went down makes sense, as I will bet you that most or all of them may have used a common authentication system. So given that it was Black Cat, now we sort of understand why so many systems were impacted. That in and of itself perhaps could be a lesson learned and deriving a new best practice moving forward. We know that Black Cat is a Russian-speaking group, but the FBI has yet to really tie the group to Russia proper, the nation, or the Russian government. So I'm sure much more work will be done on this. Black Cat employs an affiliate model, and what that is it's where entities associate with Black Cat, so cyber attackers will associate with the main Black Cat organization, and those affiliates or associates will use the ransomware software to penetrate organization systems, and therefore you get much greater reach. The ransom is shared between Black Cat, which created the ransomware, and the affiliates out there. There is some reason to believe that Black Cat has gone dark over a disagreement with an affiliate over the change attack, but it stands to reason that it will reemerge in some form. At the very least, cyber attacks and ransomware will not go away, as the change event really shows us how lucrative such attacks can be. And again, the change story is repeated each day in and out of healthcare, given the propensity to have attacks currently. So what is the current status right now of the outages and the attacks? So Change has been able to reintroduce some of its technology systems. Volume in some areas are returning to normal. In other cases, systems are not yet up or are only partially restored. Reports suggest that the last major system will be up soon. They obviously prioritize systems based on volume and impact and things like that. But other reports suggest much more work really needs to be done. The status page at Optum seems to indicate that only about 20 services are truly fully back online, and that there are maybe 100 more still offline or impacted. So it will be very interesting to see some volume numbers and things like that from providers in the next couple of weeks to see how much more work really needs to be done. Health plans and providers out there have been looking to migrate many of their critical services that were impacted from change. The problem with that is that these technology systems generally need several months to stand up, and they are very technical in nature, and there's a lot of integrations needed. So it's not like you can flip a switch and just change a service from Change Healthcare to another competing vendor. Some plans and some providers have the potential technical skills to do it, but clearly others don't, and that creates additional barriers as well. So plans and providers really had to resort to manual and paper processes to survive, as many of the electronic options that Change provided were gone, or until alternatives could be stood up and things like that. And some of those manual processes, because of all the systems not yet online, are still in place at health plans and at providers. The admin costs here and impacts, again, are huge. Some have successfully moved to other vendors. We know of several vendors out there that are taking advantage of the downturn and putting a lot more resources and standing payers and providers up as quickly as possible. In some cases, payers have gone out there and said, listen, we're going to stand up a new vendor attached to this vendor, and they're carrying some of that load there. But many others are sort of waiting for a variety of reasons and relying on Change to get systems and operations back up. And so they're a bit at Change's mercy. Beyond the provider cash flow impact that I talked about, I referenced one other major area where the attack really came at a very bad time for health plans. And this is in terms of the NCQA HEDIS quality report filings that are due in early June to NCQA and regulatory bodies like CMS and state Medicaid plans. In the first part of the year, health plans usually are really finalizing their claims and running things through the HEDIS software for administrative claims purposes for the previous year. And they're also conducting manual chart reviews against EMRs of providers to abstract results and things like that to ensure that their quality measure compliance is as high as possible. Reports are that Change's HEDIS technology systems were at least partially impacted, maybe fully impacted at this critical point. It may lead CMS and state Medicaid agencies to give these plans more time to submit, but given the recovery time and maybe some lost data, there is a big question that even with more time, could measure rates actually be impacted? So Another big thing that could impact, for example, Medicare Advantage plans that have suffered under star ratings, could it be greater moving forward here? So with that, what I'd like to do is go to our second break, and we'll come back after that to talk about, what the impact on change is going to be, and perhaps on the entire healthcare system as well.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. And we're going to sort of sum up the remainder of the podcast by really talking about impacts on change and on the healthcare system in general. So what will happen to change in the healthcare system as a whole? Well, in terms of change healthcare, change is now being investigated by the federal government for the attack. The investigation could result in understanding better whether change had a deficient technology security and or lacked readiness to respond to the attack. I mean by that from a business continuity and disaster recovery standpoint. Generally, it could mean plans and providers migrate away now and over time from change because they've lost faith. We have seen these kind of things happen in other cyber attack. Does that mean change ceases to exist? Well, maybe in name it may cease to exist because Optum and United Health Group may end up changing some of these names because of the impact. But the reality is that Change or Optum or United Health Group will maintain a major presence based on its sheer reach in healthcare in general. But clearly the reputational impact, the potential loss of revenue, potential fines depending on the results of the investigation, and lawsuits from providers and patients that are now popping up could be great. There's no question that United has the financial wherewithal to pay these costs and succeed again, but it could impact not just Change, but the wider Optum enterprise too. Will people lose faith in the service entity and the concentration of so much at United Health Group and Optum? Let's talk a little bit and review a little bit about concerns that will now be intensified based on consolidations in healthcare concentration. I told you earlier that Change Healthcare was acquired by Optum and United Health Group in late 2022. This cyber event will likely lead to a major reaction from lawmakers and regulators. There obviously is growing concern about the massive consolidations that are occurring in the healthcare industry, whether that's health plans combining, provider organizations combining, hospitals combining, or providers and physicians becoming owned by hospitals and private equity firms. And we know that President Biden has a very active healthcare antitrust agenda that is meant to better scrutinize and challenge these mergers, acquisitions, and consolidations. But what the Change event could do is certainly broaden what is looked at in this new antitrust and consolidation scrutiny, perhaps leading to examination or caps on how much of various parts of the healthcare infrastructure out there that one firm may own. With the latest technology, I would argue that it's very difficult for the big guys to say we're the only ones that are reliable or have the wherewithal to ensure performance. We see from the Change event that that wasn't the case. And I'm going to discuss in a few minutes about why that might have been. They may not have had the very best technology. I think this will also lead many to rethink whether the massive consolidation in healthcare in general is a good idea. So this could be yet another fallout. And I think that's fair. The massive consolidation has not led to a decrease in price. And in many sectors, prices actually increase due to consolidation. And I'd also note there is very good reason to think that quality suffers as well. What I mean by quality is perhaps two different things. Quality can mean outcomes from a health plan, hospital, or other provider, but it can also mean the overall efficiency and wherewithal of the system or aspects of the system. In this case, Change Healthcare has sort of shown us an example of this latter point. I say it could show us, let me emphasize that, because we don't know yet if they were negligent, but it very well, after the investigation, it could show us that overall efficiency and effectiveness and wherewithal of the healthcare system actually gets hurt with too much consolidation. We don't know yet, again, if they were negligent, but some will argue at the very least their preparedness to ensure business continuity was just not there, which will be another learning as well. And one last point on the consolidation side here is that massive consolidation might actually be anti-innovation. I think we can start to conclude some of this here. As more and more is gobbled up by the biggest firms, they do not really need to stay on the cutting edge and differentiate themselves or even be creative. They can sort of rest on their past laurels. Security and how technology are driven are two very important examples of resting on your laurels. Change may not have kept up with the technology or security times here. As well, these major organizations do not really integrate the software that they're buying and instead create this complex web of technology systems. This too leads to confusion and vulnerabilities and lack of innovation. So I think that's another important learning as well. Last, more in this case may not be better. And what do I mean by that? It puts a cyber target on a big firm's back as they have the wherewithal to pay a ransom. So the bigger you are, probably the bigger the target that's going to be on your back. And that could come out of all of this as well. I mentioned earlier that I was going to mention something a little more about change. And I think this event will lead to an overall rethinking of how legacy our healthcare system really is. And what do I mean by legacy? Well, two things really, again. On one account, many systems in healthcare are now just legacy technology, and the software and technology used to support it are more prone to outages, cyber attacks, and more. But more broadly, our healthcare technology backbone is legacy. Yes, we may have electronic payments as change facilitated. We may tinker with artificial intelligence and machine learning and things like that. But much of the technology is based on decades old, inefficient, and very brittle technology. So refreshing this technology in so many areas of healthcare is very important to keep up with the times, to be efficient, to be responsive, and absolutely to be secure. And big firms like Change and Optum and other large companies should really not be permitted to what I referenced earlier about sort of spaghetti together solutions that, again, as I said, create vulnerability and confusion. The events, too, will have us rethink cyber preparedness. And it really is important that a light be shined on our huge lack of preparedness for such events, really globally. Ironically, the federal government has published a lot of rules recently in the last couple of years prioritizing interoperability. And I do think that's a good thing. But my big question in light of this Change Healthcare event is, will interoperability really be safe and secure? So not only do we need to rethink and refresh technology in our overall system, but providers and health plans alike must take cybersecurity seriously. I would bet that there are many health plans out there that probably are not adequately ready for a cybersecurity event. And Change Healthcare is a good example of that, since it's owned by a very large provider entity, in essence, United Health Group. But I think more importantly, many providers are not ready. I don't believe all of the hospitals out there are ready, and it could be a majority of hospitals that are not. And certainly smaller providers that are pretty much independent out there certainly probably don't really understand their vulnerabilities or have prepared in a major way at all. For many, cybersecurity appears to be a bit of an afterthought. Others simply do not have the technical expertise to ensure first-class security, and still others do not have the financial resources. Post this Change event, the Biden administration did announce some major new funding it is requesting for cybersecurity preparedness, and that's a good thing. But I think more importantly, the Change events really need to lead to a national examination of cybersecurity readiness as well as business continuity and disaster recovery. So these dollars will be important. To me, it's really up to the federal government to lead the charge. They will probably pass down requirements on providers and health plans over time, and you may even have to have your system certified and things like that. I think the federal government will share dollars and make you eligible as long as you are proving that you are making progress toward real readiness. So in some ways, that should come out of the Change events and really help protect against more cyber attacks in the future. And last, I want to note that I'm very hopeful that the Change events will help lead to an overall reconsideration of how to make our healthcare system less administratively burdensome. No offense to United Health Group at all. They're a business enterprise. They're making money. But Change Healthcare, many of their systems are a textbook example of what's wrong with what we do every day in the healthcare system. One good example is Change has sort of solved issues, and credit to them, in terms of creating claim payments from providers, electronically getting them to a payer, allowing a payer to basically look at that claim and then sending a evidence of payment back from the payer to the provider with a remittance. That's sort of a claims life cycle, most of which Change Healthcare supports. Now, let's get back to this issue of administratively burdensome. Well, a great deal of what Change does, and frankly profits from, which is fair, is the fact that there are so many different price points between regions, between payers, and things like that, that providers and payers need this technology to administer the great complexity of the claim payment system in the country. Well, in my book, The Healthcare Labyrinth, which is available at healthcarelabyrinth.com, I have argued we need to get rid of this kind of waste in the system. And I've argued that we should be smart and actually adopt a uniform price setting system throughout the nation. It might be regionally for a time being because of variation in utilization and things like that. But at the very least, we would have a uniform price setting system, at least regionally, perhaps nationally. That would be the foundation for our system. Now, admittedly, you would continue to need technology to, move things from a provider to a payer, but it would probably be a lot less complex and a lot more rational if we adopted this system. And the amount of spending on administrative costs would absolutely go down dramatically. And in this way, with price being fairly uniform and much less administratively burdensome, This would allow health plans to compete on quality and service rather than investing so much of their time and money in administrative costs to solve for disparate costs and different prices throughout the system. Through such a system, I think admin costs would drop dramatically. We would have a cheaper and more rational system. And in fact, this is how every other developed world does it, regardless of the type of healthcare system they have. So maybe, just maybe, the change events will lead us to reconsider some of those administrative costs and the tremendous complexity and duplication that we have throughout our healthcare system as well. With that, we'll conclude this podcast and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.